Very shortly in Parliament, Liz Kendall will be setting out the government's plans to cut the size of the overall welfare bill and overhaul how it works. Do you support that ambition, and crucially, do you have any concerns about how they're going about it?
So I'll study in great detail the Green Paper when it's published. The basic objective of trying to reduce the size of welfare benefit bills I support, because we want more people in work if they can work, which is really important. There are disincentives in terms of those who are receiving benefits. If they try a job, it doesn't work out, they've got to start again in relation to claiming benefits. What we've got to make sure though is that safety net is still there. I've seen how important the safety net is for people who could lose their job, they may become unwell, they may need support when they're unwell, and so I'm keen to study the Green Paper in terms of what it says. And my promise to Londoners is I'll make sure that I make sure the government knows our views in relation to when we respond to the Green Paper.
One of the measures that's attracted some of the most concern has been reported plans to either freeze or tighten eligibility for personal independence payments. Is that something you'd be worried about?
Well, I've seen different reports of different days, depends which day and which report I read. What's clear is I've seen what a lifeline PIP is to those who receive PIP. What I would want to see is anybody who's really unwell who needs PIP to lose that support. That's why I want to study the details in the Green Paper and respond accordingly.
You'd agree presumably with Andy Burnham when he says that there's no case for cutting PIP where someone is entirely reliant on it, they're not able to work.
Oh, it's not. Yeah. I've met people who are on PIP who, but for PIP, would really struggle, and that's why it's really important that those people don't lose out.
My last question is Wes Streeting claiming, in the last few days that mental health conditions have been overdiagnosed in the UK and that people haven't been able to fulfil their full potential as a result of that. What did you make of those remarks?
Listen, I'm not sure about the medical diagnosis of people who are mentally unwell. What I'm clear about is I trust the experts in relation to whether it's a GP, whether it's a psychiatrist or a psychologist in relation to diagnosis. I think what Wes was talking about was more like the situation where there are more and more recipients of the benefits and how that's addressed in terms of getting people back into work. It's not for me as a politician, it's not medically trained, to talk about diagnosis over or under.